In this question, you have to identify the technique that will be suitable for fertilization in case of a couple where the male is having very low sperm count. Option A, gamete intracytoplasmic fallopian transfer, that is GIFT. Now, this is incorrect because this technique involves transferring both sperm and eggs into the fallopian tube for fertilization to occur naturally inside the body. So, it requires a sufficient number of viable sperm. Thus, it is not the ideal cases of very low sperm count. Option B, artificial insemination. Now, this technique involves collecting and concentrating sperm even from a low sperm count and then introducing it directly into the female reproductive tract, usually the uterus or the cervix. Hence, it is the correct option. Option C, intracytoplasmic sperm injection, that is ICSI. Now, ICSI is also a suitable technique for very low sperm count, but it is more advanced and it is used in conjunction with IVF because it involves directly injecting a single sperm into an egg. So, it is not the first choice when simpler methods like artificial insemination can be effective. Hence, it is incorrect. Option D, intrauterine transfer. Now, this is also incorrect because it involves transferring the embryos and not the sperm into the uterus.